Hello there, Dr. Zakir with you. So, this is part 3 video of orbital complications secondary to acute rhinosinusitis. So, as I have already mentioned, we are dealing this video in this topic in 4 different parts. So, this third part we are going to concentrate only on the investigation. So, before starting the topic, it is very important to know the different stages of the disease once it has reached the orbit. So, I have already mentioned this in part 1 and part 2, but let me summarize. So, once inside the orbit, it will be in 5 different stages. It will be preseptal cellulitis, postseptal cellulitis, subperiosteal abscess, orbital abscess, and cavernous sinus thrombosis. So, the main aim of investigation is we would like to know the patient is in which stage, so that we can decide whether he or she needs medical treatment or surgical treatment. Not only that, with special investigations we can come to know the prognosis of the disease also. So, here we go. The main investigation of choice, imaging modality of choice, is going to be CT scan. So, in case there is preseptal orbital cellulitis, there will be the CT scan is going to show like this. The preseptal cellulitis, the CT scan will show infection in front of the septum. If it is postseptal cellulitis, the CT scan is going to show that there is cellulitis inside the orbit, but there is no abscess formation. In case it is subperiosteal abscess, the CT scan will show that there is an abscess inside the orbit confined to one area, which is subperiosteal. And if it happens to be orbital cellulitis, it is going to be in the orbit you have abscess formation. And the last stage, that is cavernous sinus thrombosis. To diagnose, we need not only CT scan with contrast, we need to do an MRV. So about the CT scan I have already mentioned, depending on the stages of the disease. Now, the usual indication for MRI is only when we feel that there is secondary complication in the orbit, as like there is involvement of the optic nerve, the vision is going to be impaired, or we feel that there is a spread of disease from the orbit into the brain, intracranial complication. In these conditions, we need MRI with gadolinium enhancement. Not only that, in case the final stage of the cavernous sinus thrombosis is suspected, we need a MR venography too. That will help us for the diagnosis. Now, along with this main treatment, with that we have a diagnosis, but we don't know which bacteria is getting involved in this. So, we would like to do a nasal endoscopy, and when you find pus discharge inside the nose, we will take a swab for gram stain and culture and sensitivity, so that we know which particular bacteria is involved and which particular antibiotic can be given against that. Not only during nasal endoscopy, that is prior to surgery, during surgery also, when the pus pours out from the orbit, when you are draining it, thus that pus also need to be sent for gram stain, culture and sensitivity. Now, if the child or the patient has got a high fever, we would like to do a blood culture too. And the basic blood examination being total count, differential count, C-reactive protein, procalcitonin, then ESR, renal function test, and the other parameters also. And about the fundoscopy and visual acuity and the ophthalmology examination, already I mentioned in part 2. So these are the main investigation which you would like to do. And with this investigation, I have already mentioned what we have in our mind. We want to know the patient is in which disease and how to progress with the treatment part, whether we need medical treatment or surgical treatment. And when you come to know it is cavernous sinus thrombosis, we can tell the patient that the prognosis, the recovery is going to be late. Say maybe it will take months together, maybe 2 to 3 months for him to recover. So please do watch the part 4 video, where I will be dealing mainly with the treatment. Thank you so much.